Hello, my name is Monica and I'm here to talk to you guys about some orthotics. First up, we have our Bucks traction, which is the patient's leg is going to fit in this foam holder here with two straps to secure their leg. You want to watch out for any skin breakdown or any part of the foam is touching their skin. This will attach to the end of the bed where there'll be a bar. Depending on the doctor's order, you'll have an amount of weight you're going to put on the end of the traction. Sometimes it's 5, 10, 15, etc. Just check your doctor's order. This will hook to the rope here and create some tension on the brace itself that's connected to the patient. Okay? Make sure whenever the patient is being moved or transported to remove this brace and just set it in the room until they get back. Next up, we have the Prefo boot, is the pressure relief ankle foot orthosis. This is to provide, prevent foot drop, and it's nice and cushiony and soft, as you can see inside. It's pretty stiff as well, and there is a little kickstand on the back of it to where it can prevent the patient's foot from flopping out or flopping in. You can move it around like that and tighten the screws. Next, we have a Tefo boot, which is a tibial ankle foot orthosis. It's going to look like this. It has a metal backing with a soft inside here. And there's going to be two straps on the front that will crisscross to secure the patient's foot. And one strap up here. Nice and soft and cozy, but again, check for your skin assessment where it's touching the inside of the boot. Next, we have our Darko shoe wedge. Some of them are ordered with the wedge in the back. Some of them are ordered with the wedge in the front. Just check your doctor's orders again. It's a nice stiff shoe that some of the podiatrists and orthosurgeons like to use. Next is your pneumatic walking boot. This is a boot that's used for ankle and tibial injuries. It's pneumatic because you can pump it up to provide some compression and stability for the inside of the ankle. Next, we have your knee immobilizer. Plenty of straps here, but it's something to stabilize the leg, knee, whatever, and it's going to provide zero range of motion when the patient is in this. You just unstrap it. It's kind of self-explanatory. Open it up. Patient's leg will go in, and you just strap it back. There's two metal rods, one on the outside, one on the inside. Just make sure that's not rubbing on the patient's skin while it's on. Next is your hinged knee brace that has a degree of flexion and extension on it that will most likely be ordered by a physician. Many times a hanger, your orthotic company will put it on and you'll be putting it on and taking it off. It just goes on by buckles and tighten with Velcro straps. It can be locked and unlocked. Just make sure when it's on the patient, it is in the locked position. Okay, this is your LSO brace here for your lumbar injuries. It is applied like so. And you do want to make sure the patient has this on them prior to getting out of bed and walking around. A lot of times the physicians want this on them when they're out of bed. So you will tighten it, your little simple strap here, and then you can use these two straps, your little parachute cords for some fine tuning on the tightness. As you can see back here, when you pull them, it cinches up the waist and provides some extra support. And you are going to Velcro strap them like that. Next, we have our TLSO brace. It's virtually the same thing except it provides some thoracic support and it has the shoulder straps much like a backpack. Same gadgets at the bottom with the tightening. This is also your TLSO brace. It's a little bit simplified, but this is also going to provide your thoracic and lumbar support as well. Okay, this is the sling and swath. It is used for upper arm injuries, shoulder area. It is called a sling and swath. It will look like this when it's applied on the patient. When you are removing it, you would remove this area first. It does go around the back of the patient. And these are Velcro straps. that would be undone, and they would be applied back here like so. It goes over the patient's shoulders and then crisscrossed in the back like a pair of suspenders, and then reapplied up here in the front on the bottom part of the sling, kind of like that. And this would be wrapped back around the patient, and this mainly provides just some extra support and prevents the patient from abducting their shoulder. There you go. Lastly, this is your hard cervical collar. It will be applied like so. This here will go into the front. It has your chin holder on it, and then this will go along the back. These two will go along the base of the skull here, and you would apply like so. Make sure it's a nice snug fit, but the patient is at least a little bit comfortable in it and not having any difficulty breathing. This is your little chin lift or chin adjuster. You would just pull it out and raise and lower the chin to the level that the patient needs.